All right, guys, here we are continuing with section one of our policy course. And in this subsection, we're going to talk about different types of policy, right? So, lots of different people have tried to categorize policies in different ways. And this is just kind of one way of looking at it. And this is kind of specific to government and legal policy. And this is one way that experts have kind of decided that we can divide up policy, and it's not always clear. Again, there's a lot of times certain laws or certain policies are going to be passed and very clearly and neatly fit into one of these categories. Other times, it's not quite so clear, right? There's a lot of gray area in this kind of thing. So if you're having trouble, if you think of some policy and you're trying to think of, oh man, which one of these categories does this fit into? It's not necessarily an easy task to neatly fit policies into these different categories. The first category we're going to talk about, though, is constituent policy, right? And this is policy that kind of focuses on the operation of the organization, right? So in public policy, this would be how the government operates. This is where the Congress or the president or somebody with some kind of authority creates some policy or modifies some policy that changes how the government works, how it's organized, what processes it goes through, how laws are passed, etc. Right? So, passing a government budget would be a constituent policy. Appointing, the president appointing a new Supreme Court justice would be a type of constituent policy. Things like the filibuster in the Senate, which we're going to talk about in a future section, that is not a law. That is just a kind of Senate rule that they created themselves. But it is a rule they have set that governs the procedure of the Senate. So that would be a constituent policy because it affects how the government is run, in this case, how the Senate votes. Okay? The second one we're going to talk about is distributive policies. This is allocation of benefits and services, but kind of benefits and services that are designed for everybody. Okay? Now, student loans. If you're watching this, you're probably a college student. If you're a college student, you've probably taken out student loans. Those are distributive policies. The 2008 or 2009 auto bailout, where the United States government bailed out lots of automobile companies because they were about to fail, and that would have had a very high impact on the economy of the United States. The national parks, right? These are benefits that are kind of open for everybody. Roads and bridges and sewer systems and all those things. Those are all distributive policies that are out there for the benefit of basically everybody. One of the things we got to talk about in this section are earmarks, right? So earmarks are where, a law is going through Congress and they need some certain congressman's vote. So they put a little thing in there that says, that in that congressman's district, we're going to open a new museum or they're going to get a new fancy bridge or something in order to earn that congressperson's vote on that bill. But those are kind of benefits that are open to anybody who wants to go to that place, right? We can contrast that with redistributive policies. And redistributive policies are a little bit like the distributive, but in this case, we're kind of purposefully we're taking money or rights or social power or some benefit that one group has, and we're going to give it to others too. Sometimes by taking it away from the haves, but not always. Sometimes it's, the haves are not being deprived of anything when we are redistributing this money or rights or power or whatever. This is also, it's usually from groups that have things to those who don't, but sometimes it works the other way. We're going to redistribute money from the have-nots to the haves, right? There's been many decades worth of monetary and tax policy that have worked in kind of the opposite of the traditional direction and given more money to those who already have money, right? But other examples here are things like Medicare and Medicaid, right? We want old people and poor people, especially poor children, to have health care. So we are going to tax, especially those who are making more money, and redistribute that to the elderly, the poor, people who need it, right? In the form of medical care, i.e. Medicare and Medicaid. Voting rights, as recently as 50, 60 years ago, there were lots of states where, unfortunately, minority groups were kind of systemically prevented from voting by law. And that, so the Voting Rights Act of 1965, I want to say, don't quote me on that, it's somewhere in the mid-60s, but that Voting Rights Act kind of redistributed that ability to vote from those who have it to those who didn't, in this case, racial minorities. And there's still obviously lots of problems with voting rights and voting access, but these are much less of a matter of law today than just a matter of kind of discrimination in a non-legal way. And then, farm subsidies, right? So farm subsidies are designed to help struggling farmers because, we like to eat in this country. So we want farms to continue to run. We want farms to be successful. And in certain cases, farming can be very difficult. And thus we need to make sure those farms survive and people don't, a bunch of farmers don't have to all declare bankruptcy. Then we don't have enough farmland to feed the people. So we give farm subsidies to people. And the intention with those policies was to redistribute money from those who have it to those who need it. Unfortunately, the way it's worked out has been kind of in the opposite direction because the vast majority of farm subsidies end up going to these giant mega corporate farms rather than the small farmers that they were intended and designed to help. All right, the third kind of policy we're going to talk about is regulatory. Regulatory policy restricts some kind of behavior, right? So this is the government passing a law or some kind of other policy that says, hey, you can't do that. You're not allowed to take this action. You're not allowed to do this thing, right? The most obvious example here is criminal law. So, different levels of government have passed laws that say, hey, you're not allowed to murder people. You're not allowed to take something from a store without paying for it. You're not allowed to steal somebody's car. Those are all regulatory policies, right? But there are others that aren't necessarily criminal law. So, for instance, OSHA requirements, right? OSHA, I don't know what that actually stands for. Organizational Safety and Health Administration, something like that. I don't know. But they pass a lot of regulations and have a lot of regulations about workers in different work areas, right? So if you're working in construction, it's an OSHA regulation that you have to wear a hard hat. Or if you're working in this kind of area, there needs to be safety railings that are at least 3.5 feet high or whatever. You need to have the proper glasses when you're doing welding, things like that. Those are all OSHA regulations. And they're not really criminal, but they are regulatory. And then the last example we'll talk about here is the FCC, the Federal Communications Commission, right? So back in the days of broadcast radio and television, which obviously was very popular in the 20th century, not so popular now. We all have cable or satellite services. But there is still some, obviously broadcast television and radio. If, different TV or radio broadcasters, if they chose to use the same frequency or even two frequencies that were very close together, neither one would be usable, right? So relatively early on, the FCC decided, hey, if you want to broadcast on a certain frequency, you have to clear it with us first. You have to get our permission to broadcast on that frequency. And that way they could make sure that, if one radio station in a city was already broadcasting at a certain frequency, nobody else was allowed to broadcast anywhere near that frequency. Not just the same frequency, but anywhere kind of in a range that would provide interference. So they kind of divvied up that electromagnetic spectrum and then allowed radio stations or TV stations or whoever to apply and kind of receive their own frequency that they were then legally allowed to broadcast on, but nobody else was allowed to do it. So again, not exactly criminal, but regulatory. It restricts the behavior of people who want to broadcast radio and television signals. Now, the last one is self-regulatory. And these are relatively rare, but are important for a few different reasons. But this is where some group gets together and designs and implements or gets the government to implement a regulation on that group, right? So they're regulating themselves in order to kind of make that group exclusive, right? Now, probably the most common form of this is licensing. If you want to be a certain profession, in a lot of cases, you have to get licensed by the state in order to practice that profession, right? So like in the medical field, if you want to be a doctor, if you want to advertise that you're a doctor, if you want to get a job as a doctor at a hospital, you have to be licensed by the state. And that was the idea of medical doctors. Same thing with nursing, right? If you want to, my wife is a nurse, and she has to maintain a nursing license for the state that we live in. And kind of the reason for that is that doctors and nurses and lawyers and all these other groups got together and they said, look, we don't want unqualified people trying to claim they're one of us and then either scamming people out of money or just being really terrible at their job and giving our profession a bad name. So we're going to apply this self-regulatory process and ask the government to license people who want to join our group in order to make sure that our group stays exclusive and we can kind of regulate who is one of us and who is not, in order to prevent things like scams, things like quack doctors, okay? So it's really common in the medical professions. In the legal profession, if you want to be a lawyer, if you want to practice law, you have to pass the bar, get licensed by the state as a lawyer. And then even in the trades. So like if you want to be an electrician or a plumber or any one of those, really kind of specialized and really important trades, you have to get licensed by the state in order to kind of advertise yourself as, I can be a plumber and come to your house and fix this, because people in those trades need to know what they're doing. I mean, I've had personal experience in a couple of my different houses now where people have kind of tried to fix things like plumbing or electrical themselves and completely screwed it up. And it worked for long enough for me to buy the house before it broke. And then we had to go in and pay somebody who's actually qualified to come in and fix it. So this kind of self-regulatory process can be very important in order to maintain standards and codes of conduct and codes of ethics and construction codes and all those things, and make sure that the rules are being followed and the people who are saying that they are a medical doctor or a lawyer or a plumber, if they want to actually say they are one of those things, they have to prove it and they have to get the license from the state in order to do it. Now, that's the end of this subsection again. Thank you so much for watching.